Hi, my name is Tom Hankey, and I'm here to walk you through the Health Navigator program today. Quickly, my background is in the health plan space. In fact, I used to run a health plan called Medica. I ran the commercial division and was responsible for about 15,000 customers and of all sizes, from 5 lives or 2 lives actually, up to the largest customers like United Healthcare, Super Value, Delta Airlines, Wells Fargo, Target, Best Buy. Those are kind of some of the customers that we had at Medica. And unfortunately, I felt that the healthcare system wasn't responsive enough to employers. And I was tired of passing on rate increases as hospitals and health systems asked for more payment. And so I left to start a telehealth company in 2010, and I've been in telehealth, virtual care, and care management ever since. And I'm really excited to explain this program to you. I think you're going to like it. The program itself is a population health program. And before I get started on the details of what the program is, it's important to know that this program is for any size group from 5 lives, 5 employees, or larger. It is an additional medical benefit, a supplemental benefit that's offered on top of whatever health plan an employer offers. If they have a fully insured plan or a self-funded or a level-funded plan, that all works. And in fact, if they don't offer coverage, they can still offer this program. And it actually is a MEC. So it does eliminate Part A penalties as a MEC, and using some techniques that we have, we can also eliminate Part B penalties for large employers if need be. Now, as a supplemental program, it's offered to employees as an additional program that the employee can select. Because it's supplemental, it could be offered anytime throughout the year. It doesn't have to be offered at the same time as a renewal. And most of our customers end up launching as soon as they find out about the program because they want to get the savings. As a supplemental program, it also allows employees to make a personal choice. Do they want to participate or not? We generally will do a opt-out program where all employees are in, unless they decide they'd like to opt out of the program. And we tend to get about 92% enrollment. So employees really like this program, and you'll find out why in a moment. The program itself is built to take care of members. It engages the employee and their family members. It provides high-value care alternatives. It reduces costs for employees, and it also rewards employees with an incentive program that ends up boosting their pay a bit. In fact, most employees will take home between 2 and 4% more in a program like ours than they were before we added our program. And it also guarantees savings for employers. And these savings are pretty substantial, as you'll see in a moment. Now, the program is available and offers 3 specific program elements. It has a virtual direct primary care component, and virtual direct primary care is like telehealth on steroids. It's the same doctor each time that a patient or a family member interacts with that or needs telehealth. In fact, they get to know that doctor, and they can use that doctor to take care of all their routine health issues, and including getting prescriptions, getting lab orders, taking care of colds and flus, getting the chronic illnesses under control, etc. It also includes an overlay medical plan, which is additional medical benefits for employers or employees, as well as an incentive plan. And that incentive plan kind of supercharges the program and gets employees to engage and stay engaged throughout the year. Now, the reason we added direct primary care, in this case, virtual direct primary care, is because it works. This is a Milliman study about direct primary care, and it showed that direct primary care, when implemented, saves about 5% a percentage of outpatient surgeries that are no longer necessary because they're taken care of in a different way and not needed. There's 1 out of 4 hospitalizations are avoided in these programs in a direct primary care model, and 2 out of 4 emergency room visits are avoided. And that creates a net savings of 12.64%. And that's after you pay for direct primary care, and that can cost 5 or 6%. So this is a gross savings of about 18% for the employer on their health plan if they implement the program. Of course, these programs are not inexpensive, and so oftentimes employers would like to do this, but they're unable to, and that's what we've solved for. We have a creative way to do it, and it's taking off, as you can imagine, or as you'll see in a minute. Now, another reason we do this, a comprehensive primary care, which is employer-sponsored on-site, near-site, or virtual clinics, have shown to have even more savings. This is the JAMA study, Journal of American Medical Association study that looked at a large group in California that had some members on virtual primary care with employer-sponsored on-site and near-site. And if half of their primary care was used in one of those three settings, they fell into this cohort. They were matched with a similar cohort of employees. And what they found is the utilization went down where you'd like it to go down: surgeries, hospital, specialty use, et cetera. And it went up where you really need it to go up: mental health, labs, and primary care. It's exactly what you want in healthcare. But again, these are expensive programs. And so employers have struggled with offering these programs. And again, that's what we've solved for. In fact, this study shows a 62% reduction in PM, or per employee per month, healthcare costs. So very substantial savings. And of course, we don't guarantee that, but we aspire to savings in the 18% or more range for our customers. Now, the programs comes with two benefit packages. The first package is for the family. It includes virtual concierge primary care, which includes behavioral health virtual care, which has psychiatrist visits as well as unlimited master's level therapists. It also includes chronic illness support, care navigation, care coaching, case management, all the support that employees need throughout the year. It also, on top of that, includes a $0 copay on 200 medications. It's as simple as using a pharmacy card when someone goes to the local pharmacy, with CVS or Walgreens or any of the large systems, or even small. There are 70,000 pharmacies in this program. And so when the employees are using this program and their family members are using this, they can avoid a lot of healthcare costs. As you know, many people today have high deductibles. They might have a $5,000 deductible or a $10,000 family deductible. And going to the clinic might cost $200 to $300 per visit these days. That's pretty common. And so what we find is if a family can move 2 or 3 clinic visits away from their going into the clinic and instead use this program, they have no out-of-pocket expense. It's $0 copay in both the primary or the virtual care as well as in the prescriptions. And so they can easily save $1,000 as a family by avoiding 2 or 3 clinic visits and 2 or 3 prescriptions using us instead, and it saves them the money. Now, if they have a very rich plan, maybe a low copay plan, then the employer is going to save that money, because the employer, as people use our program, we don't bill for it to the employer. And so therefore, the employees save money for themselves or the employer in virtually all instances if they use the program. Now, in addition to that family benefit, which is for the entire family, the program also offers a benefit for the employees. And the benefit for the employees is actually in local clinics, so they can go to a doctor like normal. It includes unlimited primary care, preventive care, and urgent care at 100% coverage. No out-of-pocket expense, no deductibles, no copays. So it's a really terrific program for covering those benefits. Of course, you need to look at the certificate for the details on all the specifics, but the program does cover 100% for those categories of care. And it uses something called the First Health Network, which is one of the largest networks in the country, 850,000 total providers, a very large network. In fact, most large systems are in it, as well as many independents or smaller systems. So if you're seeing a doctor at, say, Mayo, you can use this card for the Mayo providers and get primary care, preventive care, and urgent care covered at 100%. Even though you're going to the same doctor you've seen before. So we recommend that our employees or our members show both cards to their, whatever their primary card is, as well as we recommend that they show our card, and then together the billing systems of the clinic and the hospital would then coordinate and take care of all the costs for the employee. So it's a great program, a very large network, very easy to use both in person as well as virtually. Now, that's the benefit set, and where it gets really interesting is right here. The next thing that we added to the program is an incentive plan. And this incentive plan is just like a AFLAC critical illness policy, or a critical illness policy of some type. And in those programs, an employee might pay $50 out of pocket from their paycheck. And that $50 might, if they break their ankle, they make it $1,000 from the critical illness or critical accident policy, or if they get cancer, they might get $25,000. And we do the exact same thing. But this program is built so that the employee does a claim each month in a specific category of coverage, which are related to taking care of the health issues of the employee. So every month we ask the employee to do a health activity. They're very simple, can be 5 minutes, can be longer. It's a matter of how interested the employee is in digging into the benefits. But once they do that activity, they get this incentive, and the incentive comes in the paycheck at the same time as the premium payment for the program happens. So it's a very natural program, very easy. The employees actually see their pay go up in most instances. Now, they only need to do an activity once per quarter, although we do suggest to them that they do it on a monthly basis. Now, the claims that they would interact with are stress modules, fitness modules, alcohol management modules. Over here we have depression or prediabetes. We also have interactions with our providers. If the patient uses our providers, say one month, they get a prescription refill from us. That would count as one of these activities because we coach during the session. The second quarter, they might come back and wonder if they can take vitamin C. You know, what's the limit for safe use of vitamin C or vitamin D? And that would, again, also be coaching. And then the third quarter, perhaps the employee gets a cold or a flu and needs a prescription. All of those would take care of these activities. So it's very simple for an employee to take care of the activities. Now, if they don't participate and they just never want to stay on the program, they're not willing to do any of these activities, then after a couple months, we actually then disenroll them from the program. And the reason we do that is so that we don't want anyone to have a pay reduction that is pretty substantial. And that would, of course, occur if the employee is not participating and not getting their incentive payment on a monthly basis. So they are opted out of the program for the remainder of the year. But I'm happy to say that happens very rarely, as most employees stay on the program. 99% or so stay on the program throughout the entire year because it's so easy to get these activities done. Now, the math on the program works like this. The employee puts $1,200 into their medical plan to cover all of these benefits. That $1,200 covers all the benefits, and it's put into a Section 125 cafeteria plan. And because it's put into that, it is now pre-tax. They don't have to pay taxes on that. That $1,200 would have had $300, $400, or $500 worth of taxes, depending on the state and the salary of their employee, and now they don't have to pay those taxes. The 1130 incentive payment comes at the same time, and that 1130 incentive payment is in the same paycheck, but that's not taxable because we actually use a post-tax portion of the premium to cover for this incentive plan. So it's a really attractive program for employees because they, of course, with 1130 not being taxed, will see a pay increase. Now, the math for the employer is straightforward. Because $1,200 would have been salary, but is now put into a medical plan, the employer no longer has to pay FICA on that. So they're saving 7.65%. The gross savings for that then is $91.80. So they're saving $91.80 in the very first month the program starts for each employee that participates. Now, we do charge the employer for the administration of the program. They set up the program and administer it, but the employees pay for the benefits. In the administration fee, we charge $44, and that leaves the employer with $47.80 per employee per month. Those savings add up quite a bit. In fact, that's $573 per employee per year. So for a 1,000 employer, that's $573,000. So it's real money, drops right to the bottom line, and the employers see it immediately. So as you can imagine, employers find these programs quite attractive. Now, the employee numbers work very similarly, but the employee saves even more. They save their state and federal taxes as well. So in this program, the gross pay for this example patient or employee is $4,374 per month. That's a once-a-month payroll cycle. And this employee is making about $52,400. They pay their medical premium of $83. They put their $734 in their 401k. They pay their taxes, and they're taking home $2,793. By adding our program, the 401k stays the same. The traditional medical premium stays the same. The Health Navigator premium comes out. That's $1,200. We then put 1130 back in as a non-taxable benefit because of the nature of the program, and the employee pays another $120 for the premium for this 1130 portion of the program. And so by making that payment post-tax, they no longer need to pay taxes on the benefit itself. When we calculate this, then the employee now is making $2,911 per month, which is a $125 increase for this employee per month, which is $1,500 per year. It's a pretty substantial increase. In fact, that's a 4.5% take-home pay increase. And as you probably know, if you had an employee that you wanted to give a 4.5% take-home pay increase to, you'd actually need to raise their pay by about 8% to have that work out. You'd have to pay the employer FICA, the employee FICA, the state and federal to get to then down to the 4.5. So that savings as a percentage of payroll for the employer is very attractive and really does help with recruiting and retaining employees in this difficult market for employers trying to find their employees. So that's how the program works for the employee. Now, mathematically, there's a lot of savings in this program, and I do want to emphasize that the program's for everybody on a group. Any full-time employee working 30 hours a week or more can qualify for this program, and when we run their numbers for them, in almost all cases, they're going to have a take-home pay increase. Now, the overlay plan is for everybody. If they're waiving their medical plan, let's say they have United Healthcare or Aetna or Anthem for their regular medical, but they can't afford it and they're waiving coverage, they can still do this program. So it's for everybody on the group. And there's a lot of savings here and some guaranteed savings. The first saving is if the employee does redirect some of their care to the virtual care, they can save $1,000 save in just the deductibles and copays that they might avoid. They also get their employee tax savings, which are calculated by employee or per employee. These savings are guaranteed to happen if the employer takes advantage of them. So it's 100% within the control of the employee. Now, in addition to that, the employer gets savings. They are saving their guaranteed tax savings as well. So these three are mechanical, and they work out to be about $300,000 per 100 employees in most groups. Can range a little below that or much higher than that, depending on the state and the salaries that the employees are making. So this is significant money that can be saved for everyone in the program. Now, in addition to that, as we showed you earlier, there are variable savings because this program is taking over and paying for some benefits, the primary care, preventive care, the behavioral health, some things that would have payments going that the employer would pay for. We don't have to put that in the insurance plan. So the employer saves money on those expenses. We avoid hospitalizations and emergency room use, as that direct primary care study showed. So any of that occurs will save an employer money on their underlying medical plan. Now, the underlying medical plan, if it's fully insured, they won't see that savings immediately, but they might get a better renewal. However, if they are self-funded or level funded as an employer, they're going to see these savings immediately. And it'll happen throughout the plan year because we're taking on some of the expenses and getting people's care under control. In the end, if you avoid all barriers to care, make everything free for routine care, we're able to get these employees to engage earlier, and that can avoid costs pretty substantially. Now, in addition to that, workers' compensation in some states is calculated on an adjusted gross income basis after removing benefits. And so the salary wage base would go down in this program, and the employer might see savings in the workers' compensation. I'm not a workers' compensation expert, so talk to your work comp expert, but in some states, it apparently is based on adjusted gross income. In states where it's based on pure gross income, it won't have that savings. Now, the math for one specific example, I'm going to show you an actual group that came on board. This is a 1,000-life group that we gave a proposal to. The savings for that group is $3,000 per, or excuse me, $1,000 per employee per year if they avoid 3 clinic visits and some prescriptions. So that's out-of-pocket savings. They also can save their salary increase or the take-home pay increase. In this case, the pay went up $1,916 per employee on average. And that does range by state and employee salary, so and deductions that the employee has. So if an employee is in a low tax state, it might be a bit lower. If they're in a high tax state and high income, it might be more. In fact, I see it typically range from $500 on the low end for an employee up to about $3,000 to $5,000 for employees on the high end. So those savings are both guaranteed. So if they just participate and use it, they're going to get these savings. That's 2.9 million of payroll freed up for a 1,000 life group. So it's really substantial. It's a benefit enhancement for these employees. Now, in addition to that, the employer gets their tax savings, which is the $573,000 that the employer would get for their FICA savings. And if they do get that medical claim savings, estimating at 15%, that's 1.4 million in this example. So the employer is going to save between 570,000 and 2 million. The employees are saving approximately 2.9 million if they use the program. So that's 3.5 million of guaranteed savings if used, up to about 5 million of savings for a 1,000 life group. That's really a substantial number. And another way to look at that is relating it to their employer total spend. A 1,000 life group today and a 1,000 employee employer is likely spending about $10 million for the medical benefits. That's about $800 per employee per month, or $400 per member per month, which is pretty typical across the country. Of course, that can vary. But in this example, just the guaranteed tax savings alone is like bringing down the premium by 26%. So a really substantial reduction in premium. In addition to that, if we take the claims out, that's another 1.4 million, and that brings it to 40% of what they've been spending on healthcare is coming back to them in one way, shape, or form. And if we add the copay savings on top of that, you're actually getting about half the money back that the employer was spending on benefits will come back to them in a different form, but that will come back to them if these assumptions are true. So it's a really substantial potential in the program for the employer and employees to save money. Now, the way it works for us, we actually run an analysis for each employee. It's very simple. If you'd like to get a sample proposal, all we need is the salary and the state the employee is in for each person. We don't need to know the names of the employer. We don't need to know the names of the employees. We just need a blind data census to give us an estimate or an estimated starting point. And that in this example, this is a group of maybe 30 or 40 people on this sheet. And you can see that the first person, they're saving $2,995. Their pay is going up by that much throughout the year. Another person here is saving, or pay is going up by $1,560, and the last one I'm going to show today is a person whose pay went up $4,675. So that's real money. It's a big impact to employees on a take-home basis. So this is why employers do it, and it's very simple. If we do get the first census, we can take this census data, give you this proposal really quickly, and then if they'd like to see the really refined numbers, then we do need to get the deductions and exemptions. A little bit more work. It takes maybe half hour to an hour to get the form together from your payroll company, but once you have that, we're able to implement, and we're actually able to show detailed savings by employee that are really refined. Now, what happens in this program is, of course, as you can imagine, people find it really interesting. They typically haven't seen this before, and they find it very interesting. And so there's a question that comes up very often, and that is, can this be real? Is this too good to be true? So here are some examples of different quotes we have from different customers. The first quote is from a CFO of a large software analytics company. Under the highlighted portion here, it says, the immediate reaction was, this is too good to be true. But after talking to our CPAs and attorneys about the plan, they concluded the plan was compliant on all fronts. So they implemented it and had almost 100% acceptance. The second quote here is from an IRS certified PEO. And as you probably know, there are about 1,000 PEOs in the country, and 10 or 20 of them are IRS certified. And the IRS certified PEOs commit to additional auditing, reporting, transparency. And this IRS certified PEO dug into it and found the same thing. They found that it is very compliant, and they, after carefully working through it, they decided to implement, and they put their EIN number on it. So they're very confident as well. And then lastly, we have an IRS corporate auditor who said the same thing as the retired auditor who felt the same way. Now, it doesn't really matter because it's also indemnified. So the claims administrator agrees to 2 points. This is actually part of the summary plan description, an agreement that is signed with the employer and the administrator. The claims administrator agrees to comply with state and federal statutes and regulations, and the IRS statutes and regulations are just that. And the claims administrator also will indemnify, defend, and hold the plan's sponsor and its directors, officers, employees harmless from and against all claims, actions, suits, liabilities, losses, fines, penalties, damages, and expenses of any kind, including but not limited to court costs and attorney's fees. This protects all the employees, the officers. It also protects the agent or sponsor of the plan for the broker or agent that's involved. So it protects everyone from the program and is a great indemnification and protection for everyone in this program. So the program itself, really straightforward. People, once they implement the program, they really like it. Here's a 16,000 life group on the left that found the savings crucial for their sub-businesses, for their employees. On the right, Piggly Wiggly found the plan has been the single greatest benefit we have implemented for our employees and our bottom line. Another quote here, this is an Arby's franchise owner saying, "I can honestly say our only regret was not doing it sooner, as the tax benefits have been real and tremendous." And the employees, of course, like the program, and they did see a reduction in the rate increase for their traditional medical plan. Lastly, a number of other companies that have the program like the program, of course, and are willing to share their logos. We have actually in this program 1,000 employers are doing this with over 200,000 members total. So it's a really nice growing program. It's been around about 6 years, and the customers, to our knowledge, we've never had a customer leave us. And the reason they don't, of course, is because the savings are terrific, and the program has great service and administration. But the only two types of companies that actually have left, one category would be an employer that went out of business, and obviously they wouldn't be a customer anymore. And the only other losses of customers were people that were purchased, companies that were purchased by a bigger company that has not yet implemented the program. So that's a pretty powerful testimony that everyone has stayed when they put the program in place. So that's the program. It's typically we have one other question that people ask, and I'll share that now. Employers often ask, they might say, "Hey, this sounds kind of confusing. How do we explain this to our employees?" And the process is really easy. It's a 60-day implementation process from date of quote to implementation if they would like to move forward. And what they really do is complete a couple forms. Once they've given us the census data, they give us their final detailed census. They complete a couple forms, very simple, takes 5 minutes. And then we take it from there. The first thing we do is an employer orientation session so that all of the necessary employees in the management and executive staffs are aware of the program and understand it. We ask and answer questions there. The second thing that we do is we do meet with the payroll vendor to do an integration with the payroll feed. We actually connect with that payroll company on whatever frequency that the employer pays. So if they pay weekly, we adjust our numbers for the week so that the annual savings stay true. If they're paid monthly or anything in between, we of course will sync up with that. Once we've met with the payroll company and then we understand and we make sure it's going to work that on an operational basis, we then craft an email that the employer can send to their employees. And the message for the employees is really quite simple. I just showed you kind of how the watch works, and the details of the watch are pretty technical. They're using IRS Section 125 or the Section 125 regs. We're using insurance regs, so that there's a lot of technical elements to the program. But from an employee's perspective, it's really pretty simple, and that's on the right here. The employer would introduce the program something like this. We're pleased to announce that in addition to our existing benefits, we're going to be offering our employees a new supplemental concierge care program. It includes no-cost virtual primary care for the entire family. It includes 200 common prescriptions at a $0 copay. It includes no-cost primary care, preventive care, and urgent care for the employees themselves, not the family member. It also includes an incentive if the employee, and by using the program, they'll typically see their take-home pay go up between 2% and 4%. We'd like you to participate and consider it. So would you be willing to come to an education session? So that's really the message that the employer sends out. We then schedule the education session. We walk through the program with the employees, help them understand and answer any questions they might have, and we record that call so that we can send it to new employees or to family members. And then from that point forward, we launch the program. We start emailing, texting, and contacting employees to complete enrollment and do their activities. The employee does their activities typically by app or on their computer. And if they do forget, one of the things that we will do is elevate to the employer saying, hey, could you have Bill call us? He's about to have the program taken away from him, and we don't want him to have that pay decrease or the benefit reduction. And typically then people will respond and reach out to us, which is why people stay for the whole year. It launches and the savings start occurring the immediate on the very first paycheck. So that's the program. We'd love it if you'd be interested in learning more. I'm happy to spend time with you and go through it in detail and answer any questions you might have. If you do have groups, or if you are an employer that would like to get a proposal, all we need is that simple census, which is salary and state, and we can give you a preliminary census, and then we'll create this specific proposal for you that we just walked through with your numbers in it. So that's the process. One last thing is the program itself it helps the employees, the family members, and the employer all save money. It also helps get healthcare costs in line. And as you probably know, employees are really struggling. A $400 out-of-pocket expense, that's a surprise, is more than most employees can afford right now. So offering first dollar coverage to employees that might be under financial stress with inflation and with the way things are kind of going in the economy today, I think you'll find your employers are very interested in the program, and I'd encourage you to reach out to employers that you know and get started with a proposal. I look forward to meeting you all in the future, and have a great day. Thanks.